I want to thank Campbell and Matt for having me here. I have been very involved with working with a lot of the trade associations with brokers to try to get the message out about the exchange. I started back in October, and as Campbell said, I've been in the business over 30 years. So it's kind of to step into working for the state is a little bit different. But I think it's good news that the exchange has reached out to people that have experience, that understand the marketplace, understand how brokers work. The other person that joined us in March, I believe, is the director of SHOP, Kelly Smith. She comes from also a long background in the insurance business, most recently at CDPHP. We're trying not to build this thing in a vacuum. It's not going to work without broker support, and you can't have that without understanding how brokers work. So I just want to touch on the agenda that I'm going to follow a little bit today. I want to talk about the current market state, some key accomplishments that have happened for the last few years with the exchange. What is an exchange? It's kind of basic, but you know, I do so many of these, and sometimes the understanding level can be all over the place. So I want to make sure I touch all the steps, particularly about the difference between the two exchanges. Talk a little bit about the health plan participation. Then focus on SHOP, which is really where I come from. That's my world right now is the SHOP. And talk about small businesses, the SHOP, the goals, the value prop. What value proposition is the SHOP going to have for your clients? And then talk about broker engagement. We actually just finalized, as of yesterday, broker certification for SHOP, and that's going to be available probably in the next few weeks. Uninsured. Matthew touched on that a little bit. You know that in New York State today we got 2.7 million uninsured that are under age 65. And that truly is the goal of the exchange, is to try to get the uninsured insured. Is that going to solve all the healthcare problems? Obviously not. I mean, we've got so many other issues: utilization, cost of care, people not taking care of themselves, and smoking, and all these other types of things. So this is obviously a number of things that all have to work. But having been in this business 30 years and delivering double-digit rate increases probably every year through those years, I know firsthand that this is a huge issue. It's 45 to 48 million across the country, and the issue is that if you don't have health insurance, you're not going to do preventive care. You're not going to do the tests that are necessary and so on. But eventually you will. If you do get sick, you will access the system, and when you do, the taxpayers pay for it. The people who do have insurance pay for it. So this is the whole idea, to get people insured and try to lessen that burden. Similar to auto insurance, right? We all have to have that. So it's the same kind of concept. Here's some accomplishments to date. The state was given $370 million by the feds to get this off the ground, to get the exchange going. First thing we did was establish 5 regional advisory committees that were spread around the state. These advisory committees are made up of everybody from totally different walks of life, from doctors and hospitals to insurance people to insurers to not-for-profit organizations, community service organizations. All of these people have had input into the decisions that we've made on how to create the SHOP and the exchange in general as it stands in New York. We've done a ton of research. There have been studies by Wakely, by Urban Institute, by KPMG to try to figure out how we're going to do this. This is not, just, all right, let's do it this way. We've got some data to guide us to try to develop how the exchange is going to be built. The other thing is we contracted with an IT operation to build the system. As you can imagine, this is a huge, huge undertaking. It's being built from the ground up. That company is CSC, Computer Services Corporation. They do a lot of work now for the Department of Health on the Medicaid side. They're a very, very large operation. The actual work is going on over in Rensselaer. And as we speak, they're building this. And as we get closer and closer to October, you know, the man hours are just incredible. We've also contracted with Customer Service Organization, which is going to be a big integral part of the exchange. That company is Maximus. They're also the ones that have developed the curriculum for us that's going to train brokers and navigators. Maximus, just from a customer service point of view, is hiring about 400 to 500 people between Albany and New York City to handle customer service. And customer service is at all different levels. It's for brokers, it's for individuals, it's for employers. There's going to be a lot of different levels of experience that they have. Back in January and early February, we sent out invitations to plans to participate in the exchange. We also sent out RFAs for navigators to apply for grants. Both the navigators were announced a few weeks ago, and if you go onto our website, which on this material, you can't miss it, it's everywhere and on the slideshow, you can find out who these organizations are, who was awarded the grants. Mostly made up of a lot of community service organizations, some chambers. They're now in the process of going out and hiring navigators. Navigators are not going to be hired by the state. Just want to clear that up. That's been a lot of kind of a misconception. It's the people that have gotten these grants, and the grants are about $135 million over the next 5 years. They're the ones that go out and hire navigators to primarily work on the individual exchange to help people through that process. And again, if you go on our website, you can find out exactly who they are. The health plans got a lot of press last week. DFS, you know, through their requirements with rates, need to have everything in and review rates and approve and so on. And in that process also did the exchange rates. And the companies were announced. Now, just to back up a second, that's not the final from the exchange point of view. We're still going through our quality health plan process, and we're going to announce who's in the exchange come the end of the month. It may be sooner, but the goal is the end of July. And we received certification from HHS, Health and Human Services, in December of 2012. So what is an exchange? Really, it's a marketplace. I mean, I think you've all heard this term a lot from the exchange, and that is truly the concept, to go in and be able to compare plans like you would compare apples or oranges in a marketplace. The same kind of concept, be a one-stop shopping. It's the only place where tax credits would be available. Tax credits are two different levels. On the individual side, there are tax credits for the individual that are going to be solely based on their income and where they sit in the family poverty level. On the shop side, there's a small business tax credit that's only available within the exchange. It's available now and has been since the ACA was approved back in 2010. But starting in 2014, those tax credits will only be available inside the exchange, and they're limited. They're not huge. We'll get into them a little bit as we go through. It's only for companies under 25, limited on the salary. Now, there's two programs. There's an individual exchange, and then there's the employer exchange, or a SHOP, Small Health Options Program. These are just rules that are laid out in the ACA, what an exchange is supposed to do, what are the functions. The two biggest being eligibility and enrollment and certifying the qualified health plans. Under the eligibility enrollment, we have to provide a toll-free hotline, build this web portal for eligibility, determination, and enrollment, which is, 5 or 6 words, but it's a huge, huge undertaking. It's been going on for quite a while, and it is still going on right now. have to have the ability to calculate for those tax credits that we talked about for the individual side, and also certify those individuals who will be exempt from the individual mandate. In other words, their income is too low, they're not required to have coverage. On the QHP side, again, make available, function of an exchange, make available qualified health and dental plans, assign ratings, and the actuarial value, which we'll get into a little bit. Require essential health benefits, which we've all been introduced to over the last few years, and ensure plan network adequacy. Now back in 2010, when it was introduced, there was a lot of decisions that had to be made, and this is where the Regional Advisory Committee was involved in a lot of these decisions. The first one was the group size. The feds describe small group as 100, fewer than 100. Obviously in New York, we have our own rule. In our community rated world, it's 50 and under. So there was a choice to be made. Do we accept the feds, or do we stay as we are in New York State? Regardless of what we do, we must go to the Fed rule in 2016. So the thought was, to keep the marketplace a little bit more, calmer than just changing everything, we decided to stay under 50, and we'll continue that way for the next few years. Well, at least for 2014, I'm sure we're going to. 2015 is far off, but I'm sure we're going to stay in this small group. Definition of 50 and under. But again, in 2016, we must go to 100. And in a lot of the research that we've had done, when they talk about full implementation, which I'll get into, we talk about 1.1 million members coming into the program. It's all centered on full implementation, which is the end of 2016, which would be the point in time where we have stepped into the federal rules. Another option that they gave was the market merger. You could merge the two markets, the individual and the small group. New York decided to keep them separate. This is very important feature, is standard plan selection or benchmark plan. The ACA required you to pick a benchmark plan. And that benchmark plan could be the largest group plan in the state, it could be the largest public employee plan, it could be the largest small group plan. Well, it made sense from our point of view to pick the largest small group. And what we chose was the plan design for the Oxford EPO out of down in the New York City area. It's the largest, but all that means is it's not like it's Oxford, it's just their plan design. So we use their plan design as the benchmark. And then getting back to that marketplace idea, you have an apples to apples comparison across all the companies that participate, because they have to follow, for the standard plan, they have to follow that benefit design. Another decision, which I get questions probably every day on, is the participation rules and the contribution rules. In New York State, most carriers have a lot of rules about participation. Again, as I said, I've been in this business too long, and I've heard, the old adverse selection. So I know it. We'll see what happens. But we made a decision to have no minimum participation. So if a group of 10, one person signs up, they can get into the exchange. I guess, to reason it out, to go back and say, we want to get all the uninsured and then put all these restrictions on it from a participation point of view, kind of didn't make a lot of sense from that end. An actuary might tell you, on the adverse selection side, you're going to get hurt, but we're also looking at getting a bigger universe. So for now, it's no minimum participation. And there's no minimum contribution in the shock exchange. So an employer does not have to make a minimum contribution. Now, a lot of companies will require that as well, require 50% or whatever. There is a minimum contribution required to qualify for the small business tax credit. But just for somebody coming in the shop, an employer can set it where they're not making any contribution. Again, you know, we fit on somebody, it's just compare options, ensure networks, preserve protections. These were all things that were, you know, part of the invitation. Obviously, it's all licensed and certified companies, ensuring their solvency. One of the big points in here that causes a lot of confusion is that an insurer could choose whether they want to be on the individual exchange or the shop exchange, or both. I mean, they could pick to be on both, they could pick one or the other, they didn't have to go into both of them. And that's something that was in a lot of that information that came out last week. It was a little confusing, it showed on and off the exchange and so on. And again, we're still in the process of making our decision. And to be honest with you, so are they. They still have the opportunity to pull out. And again, the standard plan that I talked about, any company that participates must offer the standard plan, the minimum, they must offer the standard plan at every metal level. Okay? And again, that's the comparison purposes. In addition to that, if they choose, they could offer another 3 plans. Now, for the most part, they're going to be plans that are, you know, have a higher benefit level than what the standard ones do. But you could see some real price variations because we're going to allow them to use special networks, things like that, that they might, you know, be able to get a better price on.
Joe, I'm sorry to interrupt. Could I ask you on that with regard to selection on the carriers, can they also then pick what region of the state they want to participate in as well?
No. But if you do the math, a company can have 16 plans. If you have 4 metal tiers, they could offer up to 4 plans. So, you know, the standard plan and then 3 other options. So they could have up to 16 plans. The old 10 essential health benefits, I think we've all been hammered with this. We just throw it up there and like to put it in writing just so everybody has it. Here's the metal tiers, the old bronze, silver, gold, and platinum. The whole concept here is as you move up the metal tier, my wife had to tell me that platinum was better than gold. I really didn't know that. I didn't, Liz, honest. But anyway, the whole concept here is this is these are charts, you know, these are that we got from the feds. You plug all your information in, you come up with these actuarial values. A lot of people think, all right, if it's 90%, I pay $1,000, or the bill is $1,000, I pay $100. It's not that at all. It's the same plans that we're used to now with co-pays and possible co-insurance and you know, deductibles and all that type of thing. When an actuary does all this, they feed the whole pool. So it's not one person that we're looking at. It's the entire pool that would be a 60% actuarial value, 70%, 80%, so on. And again, obviously, the bronze is the least expensive and the minimum affordable coverage defined by ACA. Now, on the individual side, be very similar. There is going to be a catastrophic plan, though, on the individual side that's only available for people up to age 30. So, and it won't fit this guideline. It will be, you know, less. You know, it's the whole idea is to give them some coverage so they have some protection. Obviously, you know, when you're 22, you know, nothing's going to happen. So, but to go after the whole concept of getting the uninsured insured, trying to make that a little bit easier to get them in. As I said earlier last week, there was the DFS put out an announcement and the governor did too, so this is where you can find it. But as I said, we're still in the process of analyzing from the qualified health plans, and it should be at the end of the month. I like this slide a lot. As I said, we've done a lot of research, and Manat has been huge in gathering information for us. Basically, this slide says that most of the businesses, like 98%, are under 100. They're a small group in the entire country. And New York is no different. That's where the bulk of employers are. And that number there, this little one, was given to us by Wakely, which is a consultant out of Boston, who actually were very, very instrumental in starting the Massachusetts exchange. And their study showed that 88% of all business in New York State in the small group world is written by brokers. So it doesn't take a rocket scientist to sit back and say, this is not going to work unless brokers are involved. And of course, that's easy for me to say. I've been in the business for 30 years. I know that's the truth. Massachusetts, when they first introduced their exchange, did not use brokers. So obviously Wakely didn't do this study right away. And I talked to a lot of other states as I was chatting with Campbell and Matt before, and Massachusetts is one that freely admits that that was a huge mistake to not involve brokers. This is our goals for SHOP. And again, as I said earlier, full implementation. So we're looking at hopefully these numbers to be at the end of 2016. How they come in the beginning is anybody's guess. But we're looking at about 650, overall about 1.1 million, 615,000 into the individual exchange, and about 450,000 members into the SHOP exchange, which is about 100,000 businesses over the next few years. Urban Institute is the one who did that study about the 1.1 million and where they were going to go and all this other stuff. And they did a lot more for us later. They really drilled down where they're going to come from, what's the income level, you know, ethnicity, so on and so on. They did a lot of research. The one that they did that was incredibly telling was that about 60% on the individual side of that number, that 615,000, back up there, are going to come from the uninsured. The SHOP side, very little is going to come from the uninsured, about 6%. Says a number of things. Number one, most small businesses are doing the right thing. They're insuring their people. They're providing coverage. They're giving them that option. But it tells us, as we build the shop, that we're just another competitor. We are not, we're not stepping up here saying, everybody's got to come in here. We're just another competitor out in the street. And we better be good at it because we're competing against everybody else. Because if we're only 6% is coming from the uninsured, where are they coming from? They're coming from, other plans that they're currently in. So we have to be good at it. And this is where we stepped up and defined some value propositions to make sure we're good at it. I keep quoting Wakely. They did another study where they actually spoke to small businesses on the phone. And what they did was they broke it out into small businesses that did provide coverage and some that did not. To try to get, what is it that you guys are looking for? What is it that the plan's going to bring that's going to bring some value? Now, I've been in the business 30 years. I know price should be up there first. The small group market is very driven by price. So we know that. That's a given. We got to be competitive. But then, you separate that. What are those other things, if everything's equal price-wise? What are those things you're going to bring to the table that's going to make it different? And in the study, they found that choice was a big issue amongst employers, that it offers something that they're all very, very interested in. And what that means is, within the exchange, we're going to offer multiple carriers. Where typically now, that's not the case in small group. You get one company, they might offer a couple of options, but you're not going to jump around and have, various companies. So that resonated as a nice value prop for them. Of course, some of them said, wait a second, choice? I don't want to give my employees any choice, because what's going to happen is they're going to pick the wrong plan for them. Then they're going to be upset about it, and it's going to come back on me. So I don't want to give them choice. Well, the beauty of what we're developing here is the choice is at the employer level. So the employer has many options. They could choose the multiple carrier, they can choose just one plan, they could choose just one metal tier. So they can, design it in a way where, if that was the case, where they don't think their employees can make any choice, they could select it that way. The other one's the administrative simplicity. They all love the idea of offering multiple plans, one billing. The exchange is going to do the billing for the shop, and we will get the money to the carriers. That's a great feature, but it better work. Better be simple. Also, the enrollment. The portal is being designed where we're going to have a broker portal, so a broker can come in, and that's their book of business and all the things that are related to them. And there's going to be an employer portal. If the employer gives the broker permission, they can act on the behalf of the employer. There's going to be an employee one. When selections are made, employees are going to then get an email to make the selections that the employer has laid out. That's all got to work. That's got to be simple. Early on in the game, I sat down with a lot of brokers. In fact, Phil David was the one who made the suggestion to me. We're trying to build all this fancy stuff. You're in the system situation. Oh, why can't we do that? We want to do this. We want to do that. We want to do this. And at a meeting, I had a broker say to me, "Look, worry about that fancy stuff and all the other things. Get it right first. It's got to be easy. It's got to be simple." And that philosophy has really stuck with all of us in trying to make the system very easy to maneuver. Tax credits, as I said earlier, this will be the only place that tax credits, the small business under 25 can receive those tax credits. And I go back to the study. I said they interviewed companies that offered coverage, and they interviewed companies that did not. This was real, and companies not offering coverage, it's going to be pretty hard to push them over the edge. But this was the one thing that resonated with them, that about 45% of them actually said that they would at least export because of the tax credits. When these tax credits were introduced, I can't remember the exact estimate from the budget office, the federal budget office, but we're like 30% of the actual estimation is being used. And why? Nobody knows about it. And I'm not going to point a finger at brokers. Tax consultants don't know anything about it. So either they totally overestimated it, or we're missing a boat. And one of the things, getting back to the administrative simplicity, within the portal, we are going to do an estimate, a tax credit estimate for the employers when they come in. Again, it's an estimate. It's a filing process in order for them to receive that credit. But it's going to be behind the scenes. So brokers don't have to get heavily involved in it, other than knowing a little bit about it. And if they qualify, we will give them an idea of what they're going to get. And the last value prop is the contribution options. This resonated with everybody. If it was either first or second on all of the surveys. The whole idea with this is that, and again, in the world today, it's just starting to exist in the last few years. But the idea is to set up an actual contribution amount, or a percentage, or a capped percentage, giving a lot of options to an employer on how they set up the contribution. And of course, the set amount is a nice way to plan and to budget. So these are all going to be options in the program. Again, this is just to rehash it. The employer contribution, again, the employer starts the ball rolling. They can pick just qualified health plans. They can pick specific qualified health plans. They can select by metal tier. I just want silver, or they can pick everybody in the exchange. And I know there was a lot of press about 3 or 4 months ago where the feds came out and said that remember, they're running 33 states, so I don't know, that's just pretty complicated. And they came out and said that they would not be ready in 2014 with the multiple carrier. And because of that, they gave all the states that are doing their own exchange the option of delaying it. Of course, immediately the phone was ringing off the hook that's delayed, but it's not in New York State. We are full steam ahead. And again, because we see it as a value prop, it's not something we can't do without. We need to have that to be competitive. And again, the contribution side, an uncapped percentage, cap, or defined dollar amount. Just to back up too, I don't know if I said this earlier, I know I said it to you two guys. The exchange is going to do the billing. On the individual side, that's not the case. The billing is done by the insurance carrier that the person goes with. And the tax credits are actually right at the point of service when they're going through the process with either a broker or a navigator. All that stuff's going to feed in to the IRS, and what their credit is will be automatic and sent to the carrier, who will deduct that credit right out of their monthly premium. This lays out the tax credit again for small businesses. They got to be under 25. They got to pay less than $50,000 a year, and they have to. This is where the contribution requirement comes in. They must contribute at least 50% to the single premium. Then from there, it's a calculation on how many employees they have and what they're doing. And it's a whole chart that they have to go through. These are the players, basically, that are going to be assisting people. Early on, the navigators, I know, was a huge issue for all of us in this room, whether or not, what are they going to be doing? They're not licensed, all these things. The only thing I can say about that is I agree, but we have to implement it. It's part of the federal law. We have to have navigators. That's end of story. That's the way it is. And we're going through the process to try to do that the best way. One thing you can rest assured is they will be trained, because their training is going to be a minimum of 3 days. And prior, they're going to have a lot of pre-training before they even show up at the class. So there's going to be a lot of training. But we really see the navigators, in that individual market world with the uninsured. There's going to be, you're sitting down directing people whether they pick a plan or whether they qualify for other services, Medicaid, and so on. Obviously, insurance brokers. I told you before, and that's bottom line. 88% of all small business. The sole proprietors under the federal law are sent to the individual exchange. Right now in this state, that's not the case. We don't really have an individual exchange, but they go into the small group world. And that's going to change in 2014. Sole props will be sent to the individual exchange. That in and of itself is the real reason why we said you have to allow brokers to work in the individual market. Because so many of them work with sole props. So we don't want to take that ability away. What's going to happen though, training and certification, it'll be two separate training. One for the shop exchange, one for the individual exchange. Each one's going to be an 8-hour continuing ed course. Take the course, pass the test, you can sell on the exchange. Compensation. Does anybody care about that? In the invitation to the health plans, we stated that you must pay in the shop world, in the small group world, you must pay the same commission inside the exchange as you do outside the exchange. So we're not telling them this is what you got to pay 3%. That's not what we're saying. But if you pay 3% in the outside small group commercial world, you must pay it inside the exchange. It's got to be equal. And as we all know in this room, some pay that, some pay a head count. They're all over the place. but they must be consistent and pay the same in and out of the exchange. The individual side is a little different. Many states around the country have real robust individual markets. In fact, it's where a lot of people actually, get their insurance. It's so different from state to state. New York doesn't really have one. I mean, we got about 15,000 people in the entire state that are in the individual market. They're all direct with carriers, and they all pay through the nose for their coverage. And obviously, there's no commission. What we said again in the invitation to the health carriers, we are going to allow brokers to sell inside the individual exchange. It's up to them whether or not they view that as a value and want to pay commission on it. I do know that a couple of carriers have announced that they are. At this point, we don't have all those details. As I said to you earlier, we're going to be selecting the qualified health plans at the end of the month, and our plan is probably sometime in mid-August. We've done a couple of webinars. I don't know if anybody's participated in any of them, but we're going to do another one. It might be towards the end of August, where we're going to go into fine detail on what the qualified health plans are, who's what, and I'm sure commissions will be talked about at that point. This last one, certified application counselors, was a curveball. The feds have thrown a lot of curveballs, and this was really a slider. This was something they came up with a couple of months ago, this certified application counselors, which is, again, I'm trying to show you the three paths of who's going to interact with people getting on the exchange. What they're made up of is like hospitals and facilities where people come in and get. In New York, we have facilitated enrollers that work in the Department of Health. And a lot of them are the ones that get people to qualify for Medicaid. And so we have this, almost this navigator idea created. And this is an interesting one because now a lot of those facilities that do get people that are uninsured coming in, they have the ability to get them into Medicaid. And that's where this is coming from. This is the whole idea, is that it could be a large doctor practice. It could, a lot of those types of things. Don't really see it impinging at all on broker world. It shouldn't. The training, it really hasn't even been developed yet, but there will be obviously some training. Most of this will be on the individual exchange, if not all. Okay, broker certification. You can blame me, I was the one who came up with the idea, hey, why don't we make this painless and do it as a continuing ed course? Okay, well then you can figure it out. Okay. Obviously, we've had to work with DFS, Department of Financial Services, very closely because they regulate brokers. And in order to do this type of thing, we had to use their providers, which obviously PIA is one. And it's been a long process, but we finally have got the shop one done. The individual part of the exchange has been a little bit more difficult to put that type of course together. As I said earlier, the Navigator is a 3-day minimum with a lot of learning that they're doing before they come in. So it was kind of hard to get all that kind of data into an 8-hour course. So what we're going to do is the shop's going to be a prerequisite for a broker. So if a broker wants to work in the individual exchange, they also have to get the shop certification. And we had to do that just to get the material, into, so we get a lot of stuff into the shop that you would need on the individual side. We just couldn't do it on the individual alone. Now, having said that, you could still, if John Doe wants to take the individual course just for CE credits, they can. The CE credits, the course itself. But to actually be certified to sell, we need you to get the shop certification and then the individual. Okay. Again, hopefully, they're going to start in early August. The individuals still being developed. it'll probably be more like the end of August. We are developing an online option as well. That'll be the end of August. And we're going to continue with webinars, as I said, but a lot of that's just follow-up. One of the things I used to show a lot was the portal shots, some screenshots of our portal. But we've had so many changes that we kind of stopped doing that, and we also do not have it involved. We don't have it as part of the training. So once somebody gets certified, the IT developer, CSC, is going to have these modules that at your leisure you can go into the website and go through the portal to see how it works. And of course, I know a lot of people in this room probably have staff that does that for them. They don't need to be certified. They can go in under the broker ID and get that type of training as well to see how the portal works. Again, it's very intuitive. It's going to be like what you're familiar with now, going and shopping online. It's not going to be that complicated. There will be a comparison. There'll be a spot where you can compare plans. Obviously, as I said, there's going to be a tax credit estimate. So there's going to be a lot of stuff in there, but it should be pretty intuitive. The exchange is going to have its own name, and when a lot of that rolls out, this website will probably go away, but we'll connect, from this one to the new one. It's basically just to show the flow, how it's going to work, how brokers come into the system, how an employer would come in. Obviously, an employer can do this on their own. Okay, exchanges are designed where an employer can go in and do their own, buy their own coverage. Just so you know, if an employer comes in, the first thing we're going to ask them, there's going to be a pop-up in the system that asks them, are you using a broker? If not, do you want to use a broker? And then we're going to have that designed in the system to find one. And again, I talked about the customer service. There's going to be a lot of assistance for that, online, in person, and the phone. This gives you just an idea of some of the things that, we talked early on about some of the things that happened in the beginning. We're doing a lot of outreach, this type of meeting. I throw myself out there. I know there's a lot of brokers who like to do meetings with their clients. If we can do it, we'll do it. If not me, we'll get somebody else there to address your clients. The IT development is an ongoing thing. The health plans will be selected at the end of the month. Training starting. Customer service is going to start September 2013. One of the things I didn't touch on it, the open enrollment period starts October 2013. The first effective date is January 1, 2014. Okay? Now, SHOP is an ongoing enrollment. It's not stuck on an open enrollment period like the individual exchanges. The individual exchange, the open enrollment truly is October to March. But the SHOP is an ongoing scenario. So if you want to come in March for an April effective date, you can do that. And the rates will be quarterly rolling rates, just like they're very common today in the marketplace. Again, we're going to have a name and a logo and all that good stuff come September. And everything, all the research, all the meetings, you can access everything. The webinars that we do, everything is on here. Resources is the big area up there on the right, that icon, where you're going to find a lot of that archive stuff. And there's a contact. Both Kelly and I, are available, as I said, to do meetings. Call us, email. I do get a few, so if I don't get back to you right away, I will try my darndest. If I don't get back to you in 2 days, please send it again.
Again, Joe, thanks so much for coming in. It's super